most common conversation I have is with men who know something is off. They've had their testosterone free and total drawn. They've been told their numbers are normal. They're not. Testosterone is not just about sex drive or muscle. It plays a major role in cardiovascular health, brain function, bone density, metabolism, overall longevity. From a medical standpoint, we generally want to see a total testosterone level in the range of 500 or 600, and the free bioavailable testosterone needs to be in a certain proportion. So this range, it's associated with better cardiovascular outcomes and overall metabolic health in large population studies, but insurance companies have not caught up. They don't define testosterone in this way. They want a super low testosterone before they will allow you to use insurance to pay for medication. And to qualify for coverage, men have to be truly hypogonadal. The reality is these men feel terrible long before they even met insurance criteria. They were experiencing fatigue and weight gain and low motivation, depressed mood, brain fog, reduced muscle mass for years. This is why medically supervised testosterone therapy exists outside of insurance models. It allows us to treat the symptoms and optimize health, not just wait for disease. So when it comes to treatment options, you have a couple of choices. There's injections and there's pellets. So these injections are flexible and adjustable. It allows us to fine-tune dosing more quickly and respond to how someone feels month to month. But pellets, they offer consistency and convenience, a steady release over several months, and it's ideal for men who want fewer dosing decisions and really stable levels. And neither option is inherently better than another. It just depends on the individual patient's lifestyle and response and goals. That's why personalization matters, that one-on-one with your provider. Testosterone therapy, it plays an important role in bone health. That's not talked about enough. Low testosterone is associated with low bone mineral density, and that's a higher fracture risk, especially as men grow older. There's also growing evidence linking healthy testosterone levels with cognitive health or brain function. Low testosterone levels are associated with cognitive decline, dementia. From a longevity standpoint, there's multiple observational studies showing that men, when their testosterone levels are optimized, they have lower all-cause mortality. They're not dying as often compared to men with untreated deficiency. That doesn't mean testosterone is a fountain of youth. It just means that hormones are foundational to how the body functions over time. And at our practice, we don't treat numbers alone. We treat symptoms, trends, the whole person. We can help guide you. We monitor patients closely. We adjust dosing thoughtfully. We prioritize safety, bone health, prostate health, and long-term outcomes. Testosterone therapy, when done correctly, it's not about becoming He-Man. It's not about excess. It's about your physiologic balance, where you feel good, where you feel like yourself. And if you've been told that everything is normal, not optimal, but normal, well, it's time to come talk to us, have a more nuanced conversation about hormones.